Time to talk healthcare. I've got a stellar roundtable pulled together for us. We have Ray Hanley. He's the President and Chief Executive Officer of the Arkansas Foundation for Medical Care. We have the Health Policy Director for Arkansas Advocates for Children and Families, Marquita Little, with us. Thank you so much to both of you. You guys have the best acronyms in the business. AFMC, AACF. I'm TB&P, as it says right here on the mug. So,
and we have no coffee cups.
Thank y'all for being here. Let's talk about Arkansas Works. Sure. Let's talk about the Medicaid expansion program. New study out that your organization has been pushing from the Urban Institute, Marquita. Biggest takeaway from the study for you, just maybe something that was a surprise?
Sure. And honestly, I don't think that there was much that was surprising because what it really focused on was identifying some of the common barriers that enrollees in the Arkansas Works program might have with complying with the work requirement. I think one of the things that really stood out to me was the level of detail where they were really able to narrow it down and look at barriers like internet access and transportation barriers. So it really, I think, added to the conversation that we've already been having in the state about how to prepare for the new work requirement that will be implemented.
Takeaway from me, and Ray, I want to get your take on this, was just that the universe that we're talking about is not that big when you really look at it. It was, I think, 31,000 were in what was Group 2, which would be potentially non-exempt but already working. Right. 39,000 in Group 3 that are potentially non-exempt and not working. Did it strike you as odd that it wasn't a bigger universe out there?
I thought it was understated, and it's probably going to be a little larger than that, but probably not by a lot.
What is the where do you think these folks are located? Judging from the Institute study, it seems like they're everywhere. Urban populations, rural populations. I think the myth has been that a lot of these workers are in rural, underserved parts of the state.
I think they're spread across the state. I mean, obviously more in urban areas than rural. I think the challenges are probably going to be a little greater in rural areas because of transportation and internet logistics. But that's what we as a state are gearing up to try to help them overcome those barriers. At AFMC, we're making 1,600 calls a day right now to people that are subject to these work requirements to educate them on what's expected and try to steer them to resources they need to overcome some of these obstacles.
What's been, obviously not to violate any client privilege there, but what's been the feedback from that education process?
A lot of people were not aware of it yet. They don't necessarily, read the mainstream news, and that it was going to be a requirement was a surprise to some people. But that's why we're making the effort here on the front end to reach them and educate them on behalf of DHS.
Anything happening through your organization, Marquita, on that front too?
Absolutely. So we've been engaging in some outreach and education too, really for months leading up to what will be the work requirement going live in June. And so we've actually been working at the kind of community organization level. So things like shelters, homeless shelters, providing the staff with information, trying to make sure that they feel comfortable on walking people through the work requirement and how to comply with it. And so we're going to be continuing that process. The state has also reached out, I would think, to our organization as well as several others and provided us with some information that we can share in terms of outreach. As Ray mentioned, the biggest thing here is making sure that people are aware of the work requirement. And the study, of course, highlights that the great majority of people will meet an exemption category, but those people who are exempt still have to understand what the process is that they'll have to go through in order to successfully take advantage of one of those qualifying exemptions.
No internet access, lack of transportation resources, sometimes in some areas of the state, really not enough jobs to even go apply for. Are those legitimate arguments, Ray?
Well, I think the Urban Institute was somewhat biased and obviously is not supportive of this. But I think if you look at how well organized this is compared to other states, 80 hours of activity. It doesn't have to do work. It can be, education, schooling, community involvement, volunteerism. There are things that they can do to satisfy this requirement. So I think even in rural areas, we can make this work. And I think you have to go back, last year when the program was reauthorized and refunded. No, it took a 75% vote. Governor Hutchinson literally had to thread a needle to get that. And I think the ability to get this refunded at that supermajority took rebranding it from private option to Arkansas Works and making it somewhat more conservative with these work requirements. That's what got the votes, that's what's kept the coverage, and the challenge now is for us to make this successful. Arkansas is going to be the first. I read today Kentucky's bragging they will be starting July. Not true.
Never want to let Kentucky be this year. Come on now. Basketball's bad
tomorrow. I think this is pretty well thought out, particularly the involvement of workforce services, the technologies there, and again, AFMC is there as a partner. I think that the challenge and the mission is to make it successful.
Yeah. Give you the last word on this, Marquita.
So I completely understand the political environment, which was a lot of the motivation, in my opinion, behind moving forward with the work requirement. But I think there's a larger conversation here about what people really need in order to connect to meaningful employment, in order to be able to address issues of poverty in our state. And so I think the bigger question is this what people need? Is this the right way to go about supporting families? And I personally don't think that it is. I think that there are less costly ways and more effective ways. And that's one of the things that's in this study and a number of others, that these types of punitive work requirements are not necessarily any more effective than us just addressing some of those common barriers.
All right, Ray wants to weigh in too.
Well, I think part of the goal here is to help people move up the economic ladder. And I think there's the real potential to do that for a lot of these people that will embrace this and participate.
And I do think that we will be collecting reams of data on all this so we can at least make some educated decisions moving forward on it. All right, let's take a quick commercial break. We're going to come back and talk about these schools of osteopathy that are sprouting around the state of Arkansas. And we're going to talk a little bit about the opioid crisis in Arkansas. We're back with more right after this. Welcome back to the program. I'm joined by Marquita Little and Ray Hanley. We're talking healthcare here. I want to switch our conversation to talk about these osteopathy colleges of medicine that we've seen sprout up in Fort Smith, that we've seen sprout up at Arkansas State's campus in Jonesboro here. For starters, one of you take on the task of explaining to our audience, what is a doctor of osteopathy exactly? You can be vague.
Well, they are fully licensed to practice medicine just as an MD once they finish the program. But there's a little more of healing art and osteopathic focus to this. But for all purposes, they will practice medicine just as any doctor does once they're through with the program.
Yeah. Marquita, where do you see them plugging in to have the most impact in Arkansas?
So I think one of the most exciting things about these programs is being able to fill some of the access to care gaps that are in the state. Back in 2012, 2013, we had a pretty large healthcare workforce study in the state, and it made recommendations like being able to have a kind of equitable access to primary care services, being able to recruit people to practice in more rural communities. And I really think that that's the opportunity we have here to make sure that people can get the right type of care throughout the state.
Starting to see some expansion in terms of residency participation and stuff. What's your take on that, Ray?
I think that is a huge part of this. It's almost a three-legged stool. We have the program in Jonesboro and now Fort Smith. When for 100 years we just had the UAMS and its predecessor as the school to produce our physicians, and now we have two more. And they seem more likely to move into primary care than have traditional medical students, which is what this state really needs. But the rise of the residency programs to support these graduates is one really remarkable part. And I look to Searcy, Unity Health, which operates the medical center there, Newport, and a lot of physician services, has really rolled out residency programs in multiple specialties. Ray Montgomery, who is the CEO of that, has done an amazing job. Dr. Stacy Zimmerman, who heads up the residency programs, they have put on remarkable leadership and the real potential to really build up the primary care family medicine services in the state.
As Ray said, that's really where, that's kind of the first access point for a lot of folks in the state of Arkansas. One in Jonesboro, one in Fort Smith, they really should complement each other, much less compete against each other because of regionalism and students and everything. Yet I can tell you from the media's perspective, we see them competing with each other hard and fast for attention, if nothing else. So do you think these schools will eventually find their groove and be something that they do complement each other?
Oh, I hope so, and I think it's a good thing that there's a bit of competition for recognition, because that means we are recruiting more students to come. And you know, the importance of getting that training in this state, in those residency opportunities, is that those physicians are more likely to actually practice in the places where they were trained. So I do think it'll all kind of come together, and I'm just excited for the future and what this will mean for continuing to improve healthcare in our state.
You know, I look at Fort Smith. I was in Fort Smith this week and talked to some of the officials there. You know, 160 slots. I think they had 4,000 applicants from as far away as Maine, and they gave preference to the local area, you know, Arkansas and Oklahoma, because they know the young people that come from here are more likely, once they're trained, to stay here. And there is competition. There's competition about residency slots. That's always a concern. But then I think the rise of programs like Unity Health has the potential to help address that issue. And I think they'll work it out.
Lastly, let's turn our attention briefly to the opioid crisis in Arkansas. I really just want to ask you guys a vague question on this. We hear a lot about it. We're reading a lot about it. There have been press conferences about it. There's been a lot of political rhetoric about it. It seems to have everyone's attention, but do you guys see some progress being made in terms of policy, something that is going to be impactful by the time we roll around the next session or even before then?
I do, and particularly we are really fortunate to have former Benton Police Chief Kurt Lane running the drug office, who has hit the ground running. He is passionate about this as anybody I've ever seen. He's particularly promoting for first responders the naloxone antidote for this, which if administered in time can reverse the overdose. And we've had, I think, 87 lives already saved in this that he's keeping tabs on. So I think we've made progress, but the challenge is huge. It affects so many people, thousands of people, and the drug companies have done such an awful job in the past few years in marketing this, in which you see, 20 states have filed suit about that. We have made progress, but we have far to go.
Yeah. What do you want to see happen in the next session?
Sure, I'd agree 100%. We've made progress. We have a lot further to go. And while the conversation really has been dominated by discussion about the opioid crisis, I think what it's really doing is opening a broader conversation about addiction, period, because our problems in this state and the needs in this state extend beyond just prescription drug use. So I am hopeful that as, if not in this session, we'll continue to make progress even thereafter. I'd like to see some shifting the conversation to really start to look at prevention. So combined with treatment, really looking at what we can give families and children really early on so that they never have to experience dealing with an addiction issue, and we can give them the support that they need to even prevent this from happening.
Subject matter for a future conversation that
Absolutely.
we will have.
Yeah.
So Ray, Marquita, thank you both for being here.
Thank
Appreciate
you for having
you.
us.
All right. That's all for today's program. Thank you so much for tuning in. I'm Roby Brock. We'll see you next time.